Happy New Year. Thank you for watching our briefing in English. I'm Leah Hogg, and we're going to start by speaking about COVID-19. We're live from Net TV studios. We're joined from the UK by Professor Calum Semple, who's a specialist in outbreak medicine, and he's also been awarded the OBE in 2019 for his work on COVID-19. Happy New Year, Professor. Thank you for joining us once again.
Hello.
Thank you very much for joining us. Would you give us a current status and update on the rollout of the Oxford AstraZeneca vaccine in the UK?
The first doses have been sent to primary care physicians and have been given to patients this week, which is great news. And hospitals are giving Pfizer vaccine to healthcare workers and vulnerable groups in hospital. I am personally booked for my vaccine on Saturday morning, and I'm delighted.
Well done, well done. What are your thoughts as a child health specialist on the vaccination of children for COVID-19?
This is a very difficult question because many parents are worried for their children. But the reality is that we have seen very little severe disease in children. Only 1% of hospital admissions are children. And the number of children that died in wave 1 in the UK is thought to have totaled 8. Of the children that I was aware of, all of them had severe underlying comorbidities. I only was involved in 6 of the cases. But severe disease in children is rare, whereas we know severe disease in elderly people is very common. So the prioritization of the vaccine at present is for the elderly people who are most likely to get severe disease and die.
So, in your opinion, will children eventually need the vaccine?
I'm not sure. There are some diseases where acquiring the disease naturally in childhood provides good immunity, and others where it does not. At present, we have insufficient vaccine to consider giving it to children. The priority has to be for the older population. I think in 2 or 3 years' time, we probably will be giving the vaccine to adolescents, particularly who have neurological problems, cerebral palsy, for example. Also to children who have immunocompromise and are being treated for cancers, and probably for children with severe respiratory conditions, such as cystic fibrosis, or who have been born prematurely and have chronic lung disease of prematurity. But for now, I think it's that the prioritization is for the frail and the elderly who have most comorbidities and greatest likelihood to die.
Thank you. When it comes to vaccinating children, when it eventually comes to that time, what would the ideal age, in your opinion, be for children to have a regular COVID-19 vaccination?
I don't think we're at the stage where we can predict that. We need to understand if this vaccine prevents disease and transmission. At the moment, we only can be confident that the vaccine prevents disease. If it turns out that the vaccine is very good at stopping transmission as well, then there is a better argument for vaccinating children, because that then removes a component from society that could provide onward spread for the other generations. I think if you had to guess, I think we would be looking at a vaccination program that would have to go through the years and would stepwise potentially start at the age of 16 and then a few years later go down to 12 and then a few years later go down to 8 and so on. We've struggled to implement that program for influenza. It's a challenge doing this across the whole population. Not inconceivable. We will have to see what the future holds.
Thank you. There are many vaccines appearing on the market, and I hear of people voicing preferences, whether they would prefer one to another. Obviously, they're not experts, we're not experts. Do people have a choice? Will they have a choice eventually? And who would recommend one that is better than the other?
At the moment, we don't have a choice. You have to take what is provided for your group. I have no concerns about either vaccine. I think people should take the first one that is made available to them. The technology in both vaccines has been tested now on many tens of thousands of people, and apart from headaches and the shakes and shivers of the chills that you get, which show that the vaccine is taking, apart from that, they seem to be very safe. We are aware of only a couple of examples of anaphylaxis. That's when people have an allergic reaction. We will be watching very carefully over the next few weeks to see if there are any other reactions. But at present, I cannot see any obvious choice for the people to make between the two. I think you take whichever vaccine comes.
Thank you. What are your thoughts on the strict lockdown measures in the UK at the moment?
We are in a crisis in the UK at the moment. Not only is our health service under terrible pressure, such that doctors and nurses are having to cope with making decisions about who are more likely to benefit from the highest levels of intensive care and who are less likely to benefit. That places huge psychological burden on them. There are also people who, even if they were offered the highest level of care, will inevitably die. And the death from COVID is a horrible death. People suffocate. They experience starvation of air as part of the mechanism of death. The number of people in our hospitals is very high. Our ambulance service is under pressure. And now we're starting to see sickness within other sectors of society, such as the train drivers, people that run the telephone services to support the emergency services. So, to answer your question, do I approve of a strict lockdown? Absolutely yes, I do. I think it's absolutely necessary at the moment for us to regain control of this outbreak in our society.
Thank you, Professor. And just to close off for today, just a general public health message from yourself going forward.
Please take this virus seriously. If you can work from home, do stay at home. If you must go to work, then wear the mask. If you're in contact with people, wash your hands, maintain good respiratory hygiene. There is nothing magical about the virus. The virus can only be transmitted between people. And so if you maintain distance and if you wash your hands and you wear the face mask, then you will beat this virus. So this virus can be beaten by society and science working together. The mistake is to pretend the virus isn't dangerous. the other mistake is to say that science hasn't got a solution. Both are mistakes. Together, between science and society, we can beat this virus.
Thank you very much, Professor. Thank you. Good evening. Thank you for your time.
Thank you for this opportunity.
Thank you. That was Professor Calum Semple OBE, an outbreak specialist and a special advisor to the UK government on COVID-19. On Monday this week,